My name is Loretta Morissette, and I work for Coos County Family Health Services. I work in the schools. It's an outreach program, and I started working with K to 3, and as the schools adjusted their grades and consolidated and went through changes, so did the program. So I expanded to K to 5, and with all the data showing that the need is 0 to 3, I backed up and went into the WIC program, applying fluoride varnish. As of now, I guess the program is 0 to 5th grade, and it's about 900 children per school year. All children are offered a screening in the schools. So I do a screening, send results home to the parents. Children that do not have a dental home, which is defined as 1 year without regular dental care, they're offered services, and their services include cleaning, fluoride, sealants, and a lot of case management to get them in to see a dentist if needed. All children are offered fluoride varnish services, and a lot of people take advantage of that. So sometimes people even go in and they have regular care, which is great, but they want to supplement that twice a year with the fluoride varnish. In the area that we live in, the population that we have, many people are just barely, if at all, making ends meet. Oftentimes they don't qualify even for state insurance because they are employed, and most people are very proud and they're employed, but it's not a high-paying job. It might be minimum wage, and to support a family on minimum wage is very difficult, and one of the first corners to be cut is dental. When I go into the classroom, I'm a guest, so they're always so excited to see me, which is a good feeling. You get to go in, get them excited, talk about brushing. Oftentimes, I've found that kids have misplaced, or they don't have the toothpaste, they don't have the floss, they don't have the tools that they need, the simple brush, to take care of their teeth. So it does no good for me to sit up in front of the class with my puppet and talk about how to take care of your teeth and do my whole program if they go home and they have nothing to take care of their teeth with. So I'm a firm believer of sending them home with the supplies that they need to use everything that they learned. The HNH Foundation funds the 0 to 3 WIC clinic. That is a big focus to get in and take care of these problems at an even younger age and really focus on prevention, because I get to sit with the parents, we get to sit knee to knee, we get to talk about what causes a cavity, how to avoid it, look at the child's mouth, answer any concerns that they have, apply the fluoride. I work with the WIC program with that. Another area that wasn't addressed, and that is where to send children that have no insurance. So the HNH Foundation was funding, the 0 to 3. We were getting in there early. And then you had children that I was seeing at the grade school level, and if they had decay, I was able to case manage, and if they had insurance, great, right into the dental office. If they had some sort of state coverage, great, off to the dental office. A little bit harder, but off to the dental office. But for all those people that fell in between, there was nothing. So the HNH Foundation, realized the need and addressed the need and gave Coos County Family Health Services a grant for direct services. And it is very specific. It's for children up to the age of 13 years old who are underinsured, so that they may seek care at a dental office. And of course, all of the local dentists have been great. They see these children, they get them in. I just can't say enough with how cooperative that they are. And the children go in, I case manage, they go in, the dentists deal with us for payment, and I have a place to send these children to. What am I the most proud of? That's a hard question. I'm proud of how the program has been able to morph with how the schools and the agency and the different programs have changed. We've been very fortunate that everything is flexible. We've been able to keep the program funded for, it's going on the 14th year, so longevity, I'm very proud of that. And I'm just, in general, just very proud that the children continue to be seen, continue to be serviced, and people value that. The parents value it, the funders value it. The children value it, but they don't even realize what a gift they've been given, because of course they're too young to realize that. I do have a part of my job that is the most rewarding, and that is when I see a child for dental services, preventive services, and they open their mouth and they have the sealants retained from the prior year that I've placed, and or they have restorative work done from case management, from working with the parents and the dentist, and the HNH Foundation. The parents were able to go and get that care, and they open their mouth and it's healthy. And that is the best feeling when I have a very vivid memory, and to think of what that child's mouth looked like the year before, and I'm thinking, oh, how are we going to approach this? And a full year goes by and the child is in perfect health. That is the best feeling. That's the feeling that just keeps me going with this.